Okay, so we've been talking about health insurance networks, and we've been talking about the in-network benefit and the out-of-network benefit, in addition to provider contracting. So now we're going to do some modeling. And with this tool right here, this is you could call it a claims modeler. And what that means is here in the blue, we are going to construct an in-network health insurance benefit, and then in the purple, we're going to construct an out-of-network benefit. So we'll go ahead and do that now. So we're going to work with the example we've been using in the past, and we're going to say this plan's got a $500 deductible in network, an out-of-pocket maximum of $5,500, and then a co-insurance rate of 80/20. 80% paid by the plan, 20% paid by the member. And then for the out-of-network plan, we're going to say, well, it's going to have an out-of-network deductible of $1,000, an out-of-network out-of-pocket maximum of $11,500. That's kind of a tongue twister. I'm just going to do this. And then we're going to say the out-of-network coinsurance is 60/40. So we've constructed our plan, and then here at the top, we can actually project medical expenses and see how they would be paid for each of the plans. So it's, in this column we're saying what would happen if all of those claims were assigned to our in-network benefit, or if all those claims were assigned to our out-of-network benefit, to just kind of compare what the out-of-pocket expense would be. And so the cliffhanger here, or I guess the big point we're going to make is how much difference is there between your in-network and out-of-network benefit, and it's going to be high. Now, to explain some of the accounting here that's happening before I show you the significant pieces, you can say, okay, look, I've got total claims of 15,940. We've accounted for them here, and I've got a little bit of a redundancy, and that'll go away once I start including the insurance discount. But we've got the total claim, the allowable amount, that's how much the provider is allowed to bill under the contract, and then we're accruing to the member to their medical deductible. So we've hit our $1,000 deductible, to our co-insurance, and then the balance here is the amount that the member would pay according to balance billing, the difference between what the insurance company negotiated and what the medical provider actually billed. And so if I took the discount here and we said that there was a 10% discount, you can see that in your in-network, the balance remains zero, and it always will. We can run that discount all the way up to 100%, or keep it at 10%. We can run the claims all the way up. It stays at zero for the in-network expense, and the reason for that is because the medical provider cannot bill you the balance amount when you go and see in-network. They're under contract to only charge you the allowable amount, but the out-of-network provider is not under contract to only charge the allowable amount, so they may charge the total, but your insurance company will only pay its claims against that 19,000. So for example, this deductible, this co-insurance, all of those values are based on this $19,000 right here, and then this $2,000 balance here is the difference between that 21,000 and the 19,000. So what I really want to do is just show you the significance of going out of network. So let's say that you've got a $30,000 medical claim, and we'll say 35,000. Let's say that there is no provider discount. Let's say that the insurance company is paying the full retail cost that the doctor assigns to you. Well, if they did that, then you would hit your out-of-pocket maximum, and as we run costs above roughly that $30,000 threshold, you can see these costs remain fixed. They've stopped right where they are. They've capped, and so even though health expenses are going up, the insurance company is paying the difference and the member's not paying anything. But if we were to assign the provider discount, let's say that the insurance company negotiated with the medical provider and said, we're not going to pay the $46,000. We're going to negotiate a 10% discount with you. Well, for the member, your total cost under $46,000 would be the same out-of-pocket maximum, that $5,500. But in-network, or out-of-network, I'm sorry, your total out-of-pocket costs are $15,000. And rather than move the claims, let's toy around with the provider discount and just pay attention to this member total cost section and watch how much your costs go up. So here we're saying that the insurance company was really good and they were able to negotiate a 40% discount or a 50% discount. You can see, okay, out of a $46,000 claim, under that scenario, you would end up paying $33,000 or 71%. Now, if we bring the cost down a little bit, and let's say we're going to run those claims up, but let's run the claims all the way up to 100,000, just so that we can see some exaggerated numbers here. You're still looking at 30% under this scenario. So why am I showing you this? Really, what we can postulate all kinds of scenarios. We can mess with the plan designs. We can change these around a little bit. But even as we do that, you can see that the biggest differential doesn't come from your plan design. It comes from this discount, this balance bill. You look at it and you say, okay, look, I've got in this scenario, I've got $7,700 in out-of-pocket maximum. That's $6,700 plus $1,000, but I've got $35,000 in balance billing that's being assigned to me by the medical providers. So when you hear people talk about saying, look, I've got this health insurance policy and we went to the doctor and I still got nailed with $20, $30, $40, $50, $60, $70,000 in medical bills. I mean, that's, those are the kinds of numbers I see on the news reports. This is why. It's because of that out-of-network provision there. And if you remember from the video we did before where we looked at some data, 30% discount was kind of the tail end of where discounts seemed to come in. And so there were some difficulties with that data, but at the end of the day, I'd say a 30% discount isn't a bad approximation. And on the one hand, if you go in network, those discounts are going to work in your favor because you get to benefit from those cost reductions just like the insurance company does. But if you go out of network, those discounts really start to work against you here. So the ultimate takeaway that I really want to stress here is that it is really very, very important that you stay in network. When you start hearing about medical bankruptcies, those kinds of things, I'm willing to bet 9 times out of 10 it's because there was a significant amount of out-of-network medical costs that were incurred for that person. And I don't say that to make anybody feel bad or to try and in any way kind of berate the public, as much as I want to kind of get people to be aware that your out-of-network benefit doesn't really offer you that much protection comparatively. And the comparison is you could say, okay, well, yeah, compared to a $100,000 medical claim, maybe it did. But compared to your individual financial ability to remain, financially stable and secure, your threshold's much lower than this 100,000 if you're the average American. And even if you're not, that's still a lot of money. So, again, I can ramble on. The main point I want to illustrate here is just how significant the out-of-network exposure is under your medical insurance plan, and hopefully allow this to be some sort of a motivation or impetus to encourage you to stay in network whenever possible. I would encourage a person to only look at their health insurance policy as an in-network product only. I would never encourage a person to ever buy a health insurance policy with the intention of going out of network or to rely on their out-of-network benefit. I think that's bad practice. I think it can lead to some disastrous financial exposure. So anyways, in the next video, we'll kind of look at the same thing from a graph and kind of give you maybe a 30,000 foot view. But catch you in the next video.